Love, kindness, and not a hint of judgment. This is the moment Patrick Bramwell thought may never come for him, a moment that Sunny Street helped to deliver.
Sunny Street was there, and they were the only one that actually listened to what was going on and what was there instead of being governed by the red tape.
Pat should have been enjoying his later years in life, but like tens of thousands of Australians, he found himself living rough. And just when he thought there was no light at the end of the tunnel, he came across Sunny Street.
Just to be there and sit there and talk to you and listen to you instead of saying, time's up, goodbye, and that, they just opened up and they were more like a family, a friend, and that, not medical practitioners.
He's one of thousands the Queensland-based organisation has been a lifeline for.
There's so many barriers to accessing healthcare at the moment. Quite often people have lost their jobs. They've lost heart and hope, and they don't often have the supports, so the emotional supports, the family support and the systemic supports that quite often we do, and they feel quite disenfranchised and lost, and they don't know what to do with their life and their health, and that's what we're here for.
On Tuesdays and Thursdays in this Maroochydore car park, the hungry, homeless, injured or sick gather.
And a lot of these people are really after an opportunity to get something to eat, to sit down, feel connected with somebody. There's an increasing amount of loneliness that we're seeing, especially post. But also people who want to come and actually engage for healthcare reasons.
These are the people that society frequently forgets. They're looking for someone to listen, for chronic disease specialist care or Indigenous care before their problems worsen.
Often our patients don't get medical care, so by the time they do come to us, they've had weeks, months, years of health conditions that have been unmanaged and untreated.
Sunny Street began in 2018 in CEO Sonia Martin's car boot. The organisation receives some federal funding. Its flexible and innovative approach to healthcare is delivering value above measure.
We supported Sunny Street because access for health services for the most vulnerable, homeless people and people who can't afford healthcare is so important.
Sunny Street is an award-winning benevolent organisation run as a business that could help contribute significant savings to Australia's public health system.
It's just the most amazing service, and I think that we need to encourage a lot more in our health system, because they're the people we need to keep healthy and avoid them going to hospital, which is a very expensive alternative.
Sunny Street has grown exponentially since its inception, covering the Fraser Coast down to Brisbane, hundreds of kilometres and thousands of patients, and there's plans to go nationwide.
The Sunny Street model should definitely be continued to be funded because it meets the needs of our very vulnerable population, has a high Aboriginal and Torres Strait Islander people coming to the service, and they come here because they feel comfortable. So keeping people out of hospital, which is an expensive alternative, the value for money for Sunny Street outweighs what would happen in a hospital setting.
Practitioners are creating a trusting and welcoming environment to bring back those who otherwise may have fallen through the cracks.
I think people come back to us because it's safe, they get great professional holistic care. We have services within a service, so they can come to us and we can do it all there.
A bright pink bench sits in the heart of Maroochydore. It's a place of solace and hope at the entrance to Sunny Street. There's a place to rest, familiar faces, a meal and medical treatment. For all who thought there was no place to turn, Sunny Street is there, making an impact.
They have improved my life by at least 150%.
The award-winning business bolstered not by their many acknowledgements, but by the smiles they've created, the lives they've changed, through a sustainable and caring, one-of-a-kind service that could be a game changer for our public health service.